So now I'm going to teach you how to check for diastasis recti. So take 2 fingers and you're going to put it right at your belly button, lying down, and you're going to sink your fingers in as deep as you can, and then you're going to lift your head. If you have still 2 fingers or more when you lift your head, then your abs are still separated enough to do some damage. So you want it to be 2 fingers or less, preferably 1. Then you're also going to check below the belly button about an inch or so. Again, lift your head. So here I'm more together, so I'm only about an inch here, which is good. Then I'm going to come about an inch above, sink in, and again lift, and I'm still about 2 fingers here. So that tells me my abdominal wall is starting to close on the lower end, but the upper end is still separated a little bit. So if I go to do, crunches or sit-ups, I'm going to get that doming or that cone effect, which we don't want because, again, you're just kind of causing more separation and abdominal pressure in the organs, and that's how you can get abdominal hernias and other things that you don't want to deal with. So follow along for what else you can do to keep this from getting that way. One of the best things to do, honestly, is just practice this, is kind of manually approximating your core by squeezing together. You can also use a towel under your back and pull, and you're just holding here and you're doing head lifts. So you're training that core to come back together by lifting your head up, and you're kind of just squeezing. Another great way to kind of re-educate the tissue around the abdominal wall, like the fascia and everything that kind of the connective tissue around it, is kind of pulling on your core and kind of trying to grab your rectus abdominis, so that 6-pack muscle, you want to kind of grab it, and you're going to just gently pull side to side and kind of assess which way pulls easier. So for me, pulling to the left is a little easier, so I'm going to kind of just hold that tension to the left. And then I'm going to do some head lifts. So I'm kind of re-educating all of that tissue to kind of come back together, kind of like a spider web.